So I think it's an interesting point that you bring up about testing patterns in real world versus what we ideally do in clinical trials. As we know, clinical trials are ideal setting. These are regimens that we kind of imposed in order to make sure that our patients are enrolled appropriately based on biomarker testing. In real world, however, things are never that simple. There's a lot of wiggle room. A lot of our patients don't have enough tissue for biomarker testing, which becomes a major barrier in order for us to have all the information before we start any therapy for these patients. Sometimes it becomes prudent to start some form of systemic therapy for our patients because they are quite ill due to the burden of their cancer. And those are the main challenges, I would say, that comes in real world setting when we're talking about having all the biomarker testing before starting treatment. And as we are progressing in this field with having newer and newer targeted therapies come out and being tested, it's going to become even more challenging to have enough tissue to do all these biomarker testing, and B, if they're all immunohistochemical based testing, then to kind of prudently use the tissue to prioritize which test should be done first. I think it has become very evident over the last couple of years that one subgroup of patients that should be segregated from the rest are the mismatch repair deficient or the MSI high patients who definitely seem to derive benefit from immune checkpoint inhibitors. We had seen this in Keynote 062. We'll also see in some subgroup analysis presented with Checkmate 649 this year, as well as some neoadjuvant data that was presented with a combination of ipilimumab and nivolumab in MSI-high gastroesophageal and gastric patients. So I think that's going to be an important biomarker that we will have to universally test all our patients at the start of treatment. Until now, we've been doing this pretty routinely for our advanced cancer patients, but now with the new data being presented in the neoadjuvant setting, I think it's becoming much more important that we test this even for our locally advanced patients.